Greetings. Let us learn about gallstones. Here is the liver and the gallbladder, and the gallstones form in the gallbladder. And there are different types of gallstones. Here is one variety known as cholesterol stones. Another variety that is black pigment stones, and sometimes there could be a combination of both known as mixed stones. And let us learn about gallstones. When they lie dormant in the gallbladder and they don't move around, they do not cause any symptoms. Majority of the gallstones are asymptomatic. They don't cause any discomfort, nothing. You find them incidentally when you do an ultrasound of the abdomen for something else. But if the gallstone moves down into the cystic duct, it can result in biliary colic. Biliary colic is severe right upper quadrant pain that can radiate to the right shoulder or to the right scapula, and is associated with a little bit of nausea and maybe one or two vomitings, and typically the pain resolves after a few hours when the stone flips back into the gallbladder. When the stone remains stuck in the cystic duct and does not fall back into the gallbladder, it can result in inflammation of the gallbladder wall, and when there is pain and inflammation on the gallbladder wall with thickening of the gallbladder wall and fluid collection around the gallbladder wall, on ultrasound you diagnose acute cholecystitis. So if the stone from the cystic duct drops into the common bile duct, then again you'll have biliary colic, and because there is obstruction to the bile flow, the liver enzymes get elevated, and if you do an ultrasound, because of the blockage of the bile duct, the ducts inside the liver get dilated. And these are the features: pain, elevated liver enzymes, dilation of the ducts are the features of biliary obstruction due to gallstones. And if there is fever and elevated white count because of ongoing obstruction and development of infection, then we diagnose cholangitis or acute cholangitis. When the stone from the bile duct drops down and gets stuck at the ampoule of water, then patients may develop severe pain, and because the pancreatic juice is also blocked at the ampoule of water, the serum amylase and lipase will be elevated, and because of the blockage of the bile duct, the liver enzymes will be elevated, and if you do an ultrasound, the liver intrahepatic ducts are dilated. So severe pain in the mid-abdomen lasting for several hours with profuse vomiting and elevation of the serum amylase, elevation of the serum liver enzymes, and dilation of the intrahepatic ducts on ultrasound or on another form of imaging, then you diagnose gallstone pancreatitis. So here is a gallstone pancreatitis where the stones are stuck at the ampulla and there is obstruction to the pancreatic juice flow, obstruction to the biliary flow with elevation of pancreatic enzymes in the blood, elevation of the liver enzymes in the blood, and a dilated duct. How do you diagnose gallstones in the gallbladder? You can do that by doing an ultrasound that shows stones which cast a shadow. And this is the most sensitive test for gallstones, not CAT scan, but ultrasound. So we have learned a lot about gallstones, and let us review how these different scenarios pan out when you see a patient. So here is a patient who presents with right upper quadrant pain, nausea, vomitings, and when you do an ultrasound, because you suspect gallstones, you may find gallstones and you don't have anything else, no dilation of the ducts, no thickening of the gallbladder wall, and liver enzymes are normal, pancreatic enzymes in the blood are normal, then you make a diagnosis of biliary colic, and that results in a few hours. On the other hand, if you see another patient who presents with the right upper quadrant pain, nausea, vomitings, and fever, and if you do an ultrasound, it shows gallstones and the gallbladder wall is thickened, and the blood tests show elevated white cell count, and the bilirubin and liver enzymes are normal, you suspect that the patient has acute cholecystitis. Okay? So we talked about biliary colic, we talked about acute cholecystitis. The difference between biliary colic and acute cholecystitis is the presence of not only pain, but pain with signs of inflammation, with thickening of the gallbladder wall and signs of inflammation in the blood with elevated white cell count and as well as fever. Next, another patient presents with right upper quadrant pain, nausea, emesis, and when you look at his eyes, the eyes look yellow or scleral icterus, otherwise known as jaundice. And when you do an ultrasound shows gallstones, and the intrahepatic ducts are a little bit dilated. And if you look at the blood tests show elevated bilirubin and elevated liver enzymes. So here is somebody with right upper quadrant pain, vomitings, jaundice, elevated liver enzymes and bilirubin, and dilated intrahepatic ducts. That is obstructive jaundice related to gallstones. So we talked about biliary colic, we talked about acute cholecystitis, we talked about obstructive jaundice from gallstones. So let us look at something else. So here is a woman with pain in the abdomen, severe pain, nausea, lots of vomitings, and there's a little bit of jaundice. And when you do an ultrasound shows gallstones, and the bile duct is dilated, and the intrahepatic ducts are dilated. And when you look at the blood tests show elevated serum pancreatic enzymes, amylase and lipase, and elevated liver enzymes. And in this condition, you'd suspect the diagnosis of biliary pancreatitis. So we've learned a lot about gallstones. Majority of the gallstones do not cause symptoms, do not cause any trouble. When they block the cystic duct and they fall back, that can lead to biliary colic. And if they block the cystic duct and do not fall back and lead to inflammation of the gallbladder, that is acute cholecystitis. If they fall into the common bile duct and block the drainage of the liver without infection, that is biliary obstruction. If they have infection as well, that is cholangitis. And if they block the ampulla of water and interfere with the drainage of pancreas and the bile duct, then it leads to biliary pancreatitis. I hope this is useful. Thank you.